A psychoeducation evaluation or assessment involves a battery of tests that helps with understanding one's learning. It gives one's learning profile, that is, information of how the person learns and their ability to learn, and also what they already know. What's important to note is that not everyone learns the same way, or not everyone learns at the same pace. So this is important for parents and teachers to understand, because when we do educational evaluations, it provides information on what level the person is at. If they are on the level of their peers of the same age, it will tell you whether the person is average, below average, or above average. Diagnoses that are usually given by a clinical psychologist or school psychologist usually will involve problems with attention or learning problems such as dyslexia or writing difficulties, or problems with maths, or problems with attention, which usually is ADHD, attention deficit hyperactivity disorder. These disorders aren't something that can be cured, but can be managed, and work can be done to compensate for these weaknesses. Managing these diagnoses can include getting extra time, getting some short breaks or short movement breaks or sensory breaks, or sometimes having someone help you with reading, or even remedial intervention that would help someone to improve their reading. Having concessions or accommodations such as sitting closer to the teacher or getting extra time during an examination is not an advantage for anyone who's been diagnosed with a disorder. It usually helps with leveling out the playing field for the person, so that they are actually also on par with the other persons their same age, and thus help to reach their full potential and achieve success. Early intervention is very important. Early intervention could be from the age of 7 or 8. 6 years is when an evaluation a full battery assessment can be done from 6 years old. The intervention helps because if the child has a reading difficulty or a writing difficulty, anything to do with schoolwork, early intervention would mean that the child will get all the necessary support, such as remedial intervention. It will help them to continue a normal educational path as they get older. All educational assessments should involve a cognitive or IQ test and an academic test. Other tests can include visual motor tests, tests that involve attention, behavior, social emotional measures, and personality tests. This process involves history taking, usually from parents or caregivers, one-on-one testing with the individual, the clinician's own observations, and gathering information from other sources like teachers, relatives, information from report books, medical records, as well as it involves the feedback or providing the information and results to the parents or caregivers and the written reports. Psychoeducational assessments involves educational testing. So it's actually done for school-age children, and it's dependent on whether the child isn't performing well. If the child may not be reading properly, writing properly, not holding a pen properly, in terms of their motor skills, they're having difficulties with motor skills, or even social skills difficulties, attention problems. For example, they're not sitting still in the classroom, or they're disrupting other kids. Those are some telling signs that a child might need to get an assessment. Sometimes they may not actually need to get an assessment because they might need to get some sort of intervention. Usually when they need the assessment, it's most if the teacher or parent is noticing something to do with learning. So if, as well as attention, But if it's something to do with maybe their behavioral difficulties, if they're starting fights, if the teacher notices that they are having emotional difficulties, if they might seem sad or anxious, they may not need to have an assessment done. Sometimes it is, but sometimes they may need to first see a therapist and see if there's intervention there first in terms of therapy. Sometimes if the child is having educational difficulties, reading problems, writing problems, anything to do with schoolwork, they may actually show it in terms of having behavioral difficulties. So a therapist might actually request an evaluation to be done to see if the child has any problems with schoolwork, and they rule that out, and then they would work accordingly. So what doesn't work is usually if you think that your child is having difficulties with reading, for example, and then you give them more work, such as more reading exercises. Usually more load isn't always helpful, or pressuring the child or loading the child with extra work or lessons may not always be something that is of help. Also, threatening the child, beating a child, taking away privileges, such any sort of punishment because a child has a learning difficulty will not work. In fact, the opposite is what helps. Reducing one's load may be more helpful, and sometimes subject load might be too much for a child, or certain types of subjects may be, or certain amounts of exercises might be too much for a person to manage. So reducing one's load in terms of subject or the time spent on a particular area might be helpful. But it's important to first understand one's learning profile, and thus understands that child or individual strengths and weaknesses, and therefore trying to improve the weaknesses and also continue to work on those strengths. Parents and or teachers may have concerns about their child, and what's important to note is a lot of times there may be a family history of learning or attention difficulties that you may not have been aware of. A parent or a relative may not have done well in school, they might have dropped out of school, they might have left school to pursue something else, but they may have succeeded. But it may have been that there was a learning problem or an attention problem, and this is some of the information that a psychologist would find out. And it is likely that if you are noticing some of these symptoms in a child or behavior in a child, that family history matters, and there could be a genetic component to some of these difficulties. Psychoeducational evaluations or assessments are usually done by a clinical psychologist or an educational school psychologist. The age range for testing or doing a full evaluation is usually from 6 years and up. Younger kids can do it too. It usually will be considered a developmental screening. Also, adults can have it done too if they also want to understand their learning profile better, or they may have had an undiagnosed problem. Test sessions can vary, but it involves at least 6 or more contact hours. So an assessment can determine if the child has a cognitive problem, a learning problem, attention or other behavioral problems. Thus, diagnoses of intellectual functioning, learning disorders, attention and behavioral disorders can be given. As said before, it's about understanding one's learning profile, and that is given one's strengths and weaknesses, with recommendations on how to overcome or compensate those weaknesses. 2. Gives diagnosis or rules out if there's a cognitive, learning or attention disorder. Recommendations are provided whether the child may need remedial intervention, further testing such as speech therapy intervention, medication, other therapy, accommodations and concessions like being seated closer to the teacher or extra time for examinations. All tests usually start simple and get progressively more difficult, but an assessment checks to see what the child or individual already knows. It is not a test that they have to study for. There's no preparation needed. IQ tests online are not considered to be true IQ tests. They are not considered valid or reliable. It must be done by a qualified trained professional. These tests that qualified trained professionals do are actually based on standardized data and they cannot be found online. There are no risks involved. The child may miss a few hours of school or time from a schedule. They may initially feel anxious, but testing involves that the child is made comfortable at all times. By the end of the first session, they should be more comfortable. If you have any questions or concerns about your child, be it behavioral, educational, emotional, or social, it would be helpful for you to call or visit a psychologist to get information and to see whether your child might need an educational assessment, or if you just want to find out how your child is learning, what your child's strengths and weaknesses are, and how to manage the weakness or compensate for the weaknesses, that would also be helpful. This would all help with guiding a child to be better at school, at learning, and to have a better and successful life.